In selling and service as in medicine, a prescription without a diagnosis is malpractice. Hello, I'm Dr. Guy Yatros from Dental Sleep Solutions. I ran across that quote recently from Jeffrey Gitomer. It relates a lot to some of the hurdles that dentists come across in dental sleep medicine. As we travel the country helping thousands of offices succeed in dental sleep, one of the common problems I feel is that offices want to jump to what they know. They want to jump to their comfort zone, which is treatment or talking about treatment. Oftentimes we don't listen to our patients long enough, and the patients aren't ready to hear what we have to say. With as many as 1 in 5 adults having apnea, why aren't all dental offices sending patients daily to be sleep tested? It's because of our inability to discuss this with the patients, insecurities, and maybe the way we go about it. I ask that the next time you start discussing sleep disordered breathing with your patients that you stop and pause and let the patients talk. Ask them some questions first. Get them ready to hear the answers. As you all know, most offices need a quick way to identify those patients. Most offices do fairly well. You can use questionnaires such as the Berlin questionnaire, Stop Bang. We use a DS3 tablet screener in our applications. But regardless, we need a quick way to know which patients are at high risk for sleep apnea. Most offices do fairly well with that. But the next step becomes kind of difficult. The patients have to say, oh yeah, I get it. I acknowledge that I'm at risk. And therefore, they're ready to hear the third step, which is getting them tested. Oftentimes, again, we jump right to the testing and talk to them about why they may have apnea. So I suggest you do this. Next time a patient gets finished filling out a questionnaire of some sort and they get ready to hand it in, whomever's going to be discussing with the patient, let's don't go immediately explaining it. Take the questionnaire back and look at the patient and say, "Hi, Mr. Jones, what questions do you have about this questionnaire?" And then you do that. You be quiet. You listen. You listen for their answers. Most of the time, they're going to say something along the lines of, well, what's this all about? Why am I filling this out? What does this have to do with dentistry? Now they're ready to hear at least part of it. We don't have to tell them everything we know right now. Let's just answer the question that they ask. They ask why, and we explain. Well, you know, Mr. Jones, we care about your health. And as a dentist, it's our job to be looking at the area of your mouth and the back of your throat. As many as 1 in 5 adults has a problem back there at night. Right in the back of the throat, the airway becomes very, very narrow in some patients, even closes off. And those patients struggle to breathe. And we as dentists are in the best position to discuss this with our patient. It's our job as a healthcare provider to ask you these questions to see if you're at risk for your airway closing off while you're asleep at night. And then you be quiet again and let the patient talk. See what they have to say about that. Hopefully they'll ask another question. Most times they do. Well, what did you find out? What did this show? They will often say. Well, let's take a look when they do. Hopefully you have a quick way of reviewing whatever questionnaire you're using. In DS3 we have a little drop-down box that has all their answers, and we can quickly look at that. Assuming maybe their Epworth is high. Well, let's discuss these one at a time. So, well, Mr. Jones, there were quite a few questions about sleepiness. And one of the things that comes up here is it looks like that you're having trouble staying awake during the day. Can you tell me more about that? Ask them questions about their sleepiness. They'll be happy to tell you in most cases about the sleepiness. And then we can relate that to, well, there's one common reason for that. One of the most common reasons is, back to this airway, people struggling to breathe don't sleep well. And it's resulting they're tired. So maybe this has something to do with you being tired at night. And then we be quiet and listen for what they have to say. As we go through each of their red flags or whatever they were at risk to put them at the high categories, such as diabetes or hypertension or other things, we can discuss each of those. We can say, well, Mr. Jones, you have hypertension. 1 in 3, or probably more than that by some studies, people who have hypertension, one of the causative problems are they can't breathe at night and they're starving their bodies for oxygen. So you're at least at a 30% chance or better of having airway problems that are leading to the sleepiness and to this to your hypertension, making it worse. Even though I understand it's very well regulated with your medications. And then we pause again. Eventually, if we have this conversation and we allow ourselves the time and we take the time to talk to our patients about this, and we sincerely believe in what we're doing, the patient's eventually going to say, wow, this is all adding up to maybe I have a problem. How do I know if I have a problem? And that's our goal. Our goal is to get them to ask that golden question. How do I know if my airway is closing off? Once they ask that question, then we hopefully have a great answer. My answer typically is, well, we just need to test your breathing at night. There's two ways of doing that. One is you can do it in a sleep lab. The other is that you can wear a portable monitor at home that measures your breathing. Which way would you prefer? Most patients say, I'll take the home test, or even if they want the lab test, hopefully you have a way to implement those in your office. Now that's a whole nother Dental Sleep Medicine Insider video that we may do another day, but hopefully you have a way of getting them tested. I hope that this has been helpful, and I hope that you'll take the time to listen to your patients. If you'll listen instead of tell, give the patients an opportunity to discuss whatever screening method you're utilizing in your office. They will accept the idea of going to be tested, but not until they're ready to hear for it. The pause is important, the listening is important. Thank you so much for taking the time to watch this video and for reading this edition of Dental Sleep Medicine Insider. Again, I'm Dr. Guy Yatros from Dental Sleep Solutions and DS3.